Joining us for a little bit is economist Dr. Lauren Scott. Hey, Mr. Lauren, how are you this morning?
I'm great. How you guys?
I'm getting younger every day, and I know you believe that one, right? Let's start with, there's a study we want to talk about with you this morning. And just to clarify out of the blocks, it involves our local hospital, well, actually the privatization of hospitals across the state. So we're talking for Shreveport, or pertinent to Shreveport, University Health.
The hospital segment, as I appreciate it, that we're talking about here. And this is one of 8 that took place across the state. We actually joined 48 other states in this process of having this health care for the lower income strata being delivered by the private side rather than a publicly run hospital.
Now, a million people have been just critical for years about Governor Jindal's privatization. Did your study find that this criticism is warranted or maybe unjustified?
Well, I think it's very much unjustified. Again, if it wasn't a good idea, then how come 48 other states are doing it this way? There's only one other state besides us that was doing it, and that's Hawaii. That should be one signal to us that perhaps we're doing it the wrong way. Plus, as an economist, I believe that the private sector has a tendency to do things more efficiently than the government side does because they're dealing with their money, not somebody else's money. And as it turns out, there was just some peculiar federal rules that when we did this privatization effort, for example, the physician pay was not subject to federal match monies before this privatization took place. Once the privatization took place, suddenly the federal government started sending us a whole host of money, about $1/3 billion a year, to match monies we were paying to our doctors. Then a lot of these people who privatized took over the old facilities and made lease payments to the state, and those lease payments, as it turns out, were subject to a federal match. So basically what happened here is over a 4-year period, about $2.7 billion ended up flowing into the state treasury that was not there before the privatization effort.
Doc, you'll hear Senator Greg Tarver say doctors are leaving. The wait times are longer now at the hospital. Lots of criticism will come from a leading state senator from our area. Your study disputes that directly, correct?
It really does. I mean, if you look at the data that we provide in the report, especially on things like wait times, our data indicate that the wait times have not only gone down, but they've gone down dramatically. Like the wait time to get an MRI has dropped from 60 days to 2. To get a CT scan has dropped from 21 days to 1. There are a lot of new treatments now that are available to this lower income strata that were not available here in Shreveport. You had to go to New Orleans. Now they're available here. You have more operating room suites. You have a new cardiac catheterization lab. There's just a lot of things that happen as a result of the privatization effort that were really good. And really, I'll tell you, right now the legislature is dealing with a very serious budget deficit and is struggling through how to handle this. Think for just a moment if they had not received $2.7 billion over the last 2 years. Think how much worse this budget deficit would be. So the privatization effort, I think, helped in a lot of ways. I think it helped improve the quality of care that the lower income strata get. But I think the other thing is it just really improved the state budget, and it really improved y'all's economy in the northern part of the state.
You're going to hear critics say that BRF and the others paid for the study. So the study is suspicious. I know that's the elephant in the room. I know you want to address that.
Well, I mean, that's fine. And we have been around for doing economic impact studies for 35 years. And I think what people have learned who have hired us is that we take the data and we take the data as is and we run with it. And if, matter of fact, we tell people up front, we're going to do the impact study for you, but the number's going to be what the number's going to be. If you don't like them, that's fine, as long as you pay us. That's all we care about. But if you don't like it, you can throw the study in the trash can. Mm-hmm. So I think we have a long history here. We have 3.5 decades of being a disinterested third party. I've got no interest in this at all.
Right.
It doesn't matter to me one way or the other. So I think we've had a long history of being a disinterested third party, and that's the way we treat it this time too.
When you put a figure of $1 billion impact in North Louisiana, what is that impacting? Is it impacting jobs, sales tax revenues, a whole bunch of stuff, right?
Well, it's a whole bunch of stuff. As it turns out, the $1 billion figure refers. What we do is some of this money flowed back into the state treasury, but then some of that money flowed back to the 21 parishes in the northern part of the state. And we have a model that shows how much of that money we think flowed back in, primarily into higher ed, into health care, that was not going to be there. This privatization effort didn't take place. The $1 billion refers to the amount of new sales that was enjoyed by firms in this northern part of the state over a 4-year time period. So the $1 billion refers to sales. We also estimated the household earnings, which is about $400 million over this time period, and it created, on the average, about 2,800 jobs over this time period. So if you look at the Shreveport area, the Shreveport has been, I don't know if you realize this, has been in kind of a funk since 2008. You peaked back in 2008. You're about 11,400 jobs below that 2008 peak, and think how much further down that number would be if this privatization ever had.
Doc, we're talking about a whole lot of money that you say benefits our area. Do you have a number? Did your study show how much of all that money is being put back into the hospitals, specifically being spent on patients?
We did not look directly at that number. The nature of the animal that we were working with, it wasn't quite able to do that. I can tell you, if you'll give me 2 seconds, we were able to come up with an estimate of how much money we think flowed back into your area for higher ed and for health care. We estimate that a total of about $590 million flowed into a combination of health care and higher education. So about half of that, half of 590, let's see how quick you can do that, about $300 million over a 4-year time period flowed back into health care, and about $300 million into health care, into higher education.
Did you find any negatives or any cautions in your study, things we need to keep an eye on?
Not really. As a matter of fact, it's kind of interesting. We looked at the impacts over 2013, 2016, and all the positive impact numbers are going up. They're not going down. If they were going down, then we would get worried, say, what's going on here? There's something amiss. But so far, we haven't seen any negatives. And I think, if you think about it for a minute, why did 48 other states do this a long, long time ago? I think that's because it's the proper economic policy to do.